The first known case of severe strain of the mpox virus has been detected in New York City. And to help us better understand what this means, we're joined now by Dr. Sharon Nachman, Chief of Pediatric Infectious Diseases at Stony Brook Children's Hospital. Doctor, thank you for joining us this morning.
Good morning.
Now, people who have lived in New York for a few years may remember the mpox outbreak back in 2024. Those cases were clade 2, while this most recent case is clade 1. What are the different types of mpox and how do they compare?
Well, the two different types are, as you mentioned, type 1 and type 2. Type 2 is less severe. Type 1 is more severe. The lesions spread over the body much faster. And more importantly, it has a higher lethality, meaning it kills more people. So we're much more concerned about type 1 and are very aggressive about preventing its spread here in New York.
Now, the city's health department says the person who did test positive recently had traveled to Europe. How concerned should people be about the possibility of additional cases spreading here?
Well, most importantly, once it's recognized, we put infection control practices into place. Meaning we restrict contact with that person. We vaccinate people who have close contact around them. This is not a respiratory infection like flu or COVID. It's an infection that spreads via close contact and touch. So seeing someone in the hallway will not spread it. However, someone who is in close contact, eating with them, touching with them, sleeping in the same bed with them are at risk. But good news, we do know how to prevent its spread. We have a vaccine, 2 doses of which will be highly protective. So those people in close contact with this individual all need to be vaccinated. And anyone who travels who thinks they may fall into those risk categories should also get vaccinated.
Doctor, what are the symptoms people should watch for and how long is someone contagious?
Well, most importantly, the symptoms are quite visible. While you may be infectious for a few days before the rash breaks out, the rash is very, very easy to spot. It spreads across the body. It's quite noticeable. It's not a subtle rash. So once you have a rash, we know you're infectious, and that rash usually lasts between 2 and 4 weeks. So you are infectious until all of the lesions dry up and your skin is clear.
I'm just curious, is this an itchy rash or, how does it usually feel?
It looks like blisters. It's quite painful. And in fact, it's quite noticeable. It's not 1 or 2 blisters that perhaps you don't know what it is, but rather blisters that cover a lot of your body. So it is quite easy to see and quite easy to diagnose. And of course, we can tell if you do have the rash, you should stay away from other people because that rash means you're contagious by touch.
All right, Dr. Nachman, thank you so much for your time. We really appreciate it.